A penile implant is an erection assistance device used in the treatment of erectile dysfunction, or ED. A penile implant is placed inside the body during a surgical procedure, which in the majority of cases is outpatient procedure. There are two types of implants available, including inflatable penile implants such as Titan implant and malleable penile implants such as Genesis implant. Both types are completely hidden inside the body and can create an erection at any time for any duration. The most common implant is the inflatable penile implant. However, we will discuss which implant is best for you and your partner during our consultation together. The Titan inflatable penile implant is a 3-part fluid-filled system that is inflated to create an erection. The 3 parts are a reservoir that is typically placed in the lower abdomen, 2 cylinders in the shaft of the penis, and a pump located in the scrotum. The inflatable implant is designed to look, function, and feel like a natural erection. It is completely contained inside the body. To get an erection, you or your partner squeeze the pump in the scrotum. Each squeeze moves some of the fluid stored in the reservoir to the cylinders in the shaft of the penis. As the cylinder fills with fluid, the penis then becomes fully erect. You can keep this erection for as long as you and your partner desire. When you no longer want to be erect, simply squeeze the deflate button on the pump and your penis returns to the flaccid or soft state. For men who may have trouble squeezing the pump, such as those with poor hand dexterity, limited strength, or range of mobility, a malleable penile implant may be the best option. This implant consists of 2 flexible silicone semi-rigid rods implanted in the shaft of the penis. With this device, when you want an erection, you simply position the penis up, and when you no longer want an erection, you move the implant into the down position. The Titan implant is made of silicone, polyurethane, and a material called Bioflex that is safe for your body and is stronger than silicone alone. The Bioflex material is unique material specifically engineered for penile implants to make them stronger and more durable compared to other penile implants. The fluid stored in the reservoir of the implant is sterile saline solution. The saline is placed in the reservoir at the time of your procedure and cycles through the system on demand without needing to be refilled. Inflatable penile implants are a long-lasting solution for erectile dysfunction, with an average of 75% of penile implants lasting 10 years or more. In testing, the Titan implant was shown to last more than 6.5 million cycles without breaking. In general, most men with ED may be good candidates for penile implant. Candidates can include men who have tried and failed other ED treatments, or those who have had prostate surgery or other treatments for prostate cancer. Good candidates for a penile implant may also be men with pre-existing conditions, such as those with cardiovascular disease or diabetes. These men may not be able to take oral medications, or oral medications may not be effective. It is important to know that there is no requirement to try oral medications prior to moving forward with the penile implant. If you have poor dexterity in your hands, you may not be a good candidate for an inflatable penile implant, but you may be a good candidate for a malleable penile implant. You're not a good candidate for penile implant if you have an active infection anywhere in your body, especially urinary tract or genital infection. You're also not a good candidate if you're allergic to silicone or polyurethane. In addition, if you have problems with urination from bladder outlet obstruction or neurogenic bladder, the penile implant is not an option for you until those concerns are resolved. Despite the durability of penile implants, you need to be mindful that your device may need to be replaced during your lifetime. If you prefer not to have a second surgery to restore erectile function, you should not consider a penile implant. There are also some other considerations that we will discuss should you feel the malleable implant is the right treatment option for you. Please refer to the important safety information at the end of the video for these additional considerations. We understand everyone's ED treatment journey is different. During your appointments together, we will discuss all options and will determine the best solution for you and your partner. The penile implant is custom fit to your existing anatomy at the time of the procedure and is intended to optimize the length of your penis. During the procedure, I or your surgeon will measure the total length of your erectile tissue and place an implant that is best fit and size for your anatomy. The implant fits alongside your existing anatomy. Inflatable penile implants are an effective solution for erectile dysfunction and have a high satisfaction rate for both patients and their partners. A study of tightened penile implant patients reported a 98% satisfaction rate, and their partners reported a 96% satisfaction rate. Like any surgical treatment, there are potential risks with penile implants. Risks include, but are not limited to, device malfunction such as break or leakage, infection, inflation difficulty, erosion, and incorrect sizing. Also, after a penile implant, it's no longer possible to have spontaneous or natural erections, and most other ED treatments will no longer be effective. If you're able to orgasm, climax, and/or ejaculate before the implant is placed, these abilities should not be affected by the implant or the procedure. The inflatable penile implant is completely concealed inside the body. In the soft and non-erect state, the penis appears and feels natural. No one can tell that you have the implant. Because of its nature as a flexible rod, the malleable implant is a bit different. The malleable implant stays firm when placed in the down position. For this reason, it may be more visible than the inflatable implant.